Hello and welcome straight to the point news. Just when we thought that we had COVID under control, that Delta was going down, another variant appeared out of nowhere, and now it's named as variant of concern. We know what Delta did, how the cases rised in India, then here in the United States. And now this is like another variant that's putting fears into people's hearts. So today, the World Health Organization, they did an update on Omicron, which is the new variant. So they said that, and I quote, on 26 November 2021, WHO designated the variant B11529 a variant of concern named Omicron on the advice of WHO's Technical Advisory Group on Virus Evolution. Tag V. This decision was based on the evidence presented by the Tag V that the Omicron has several mutations that may have an impact on how it behaves. For example, on how easily it spreads or severity of the illness it causes. Here is a summary of what is currently known. So I'm actually getting to know this variant myself along with you guys, and let's continue. Current knowledge about Omicron. I love how they're coming up with these names like some type of big villain. Anyways, as we continue, researchers in South Africa and around the world are conducting studies to better understand many aspects of Omicron, and will continue to share the findings of these studies as they become available. Transmissibility. It is not yet clear whether Omicron is more transmissible, for example, more easily spread from person to person compared to the other variants, including Delta. The number of people testing positive has risen in the area, South Africa, affected by this variant. But the epidemiology studies are underway to understand if it is because Omicron or other factors. So they're wondering if it's because of the variant that the cases are rising in that region. So severity of the disease. It is not yet clear whether infection that with Omicron causes more severe diseases compared to the infections with other variants, including Delta. Preliminary data suggests that there are increasing rates of hospitalizations in South Africa, but this may be due to the increases overall numbers of people becoming infected rather than the result of specific infection with Omicron. So right here they're saying that there's more people in the hospital, but that is because there is just more cases in the country overall. And we continue. There is currently no information to suggest that the symptoms associated with Omicron are different from those from other variants. Initial reported infections were among university students, younger individuals who tend to have more mild disease. But understanding the level of severity of Omicron variant will take days to several weeks. All variants of COVID-19, including the Delta variant that is dominant worldwide, can cause severe disease or death, in particular for the most vulnerable people, and thus prevention is always key. So we continue. Effectiveness of prior SARS-CoV-2 infections. Preliminary evidence suggests that there may be an increased risk of reinfection with Omicron. People who have previously had COVID-19 could become reinfected more easily with Omicron. So this is for people who got COVID-19 and they think they're invincible. Right here it said that the preliminary, like the evidence is still new and small, but says that the people who had COVID-19, they can get reinfected with this new variant as compared to other variants of concern, but information is limited. More information on this will become available in the coming days and weeks. Effective of vaccines. WHO is working with technical partners to understand the potential impact of this variant on existing countermeasures, including vaccines. Vaccines remains critical to reducing severe disease and death, including against the dominant circulating variant Delta. Current vaccines remain effective against severe disease and death. Effectiveness of current tests. The widely used PCR tests continue to detect infection, including the infection with Omicron, as well as seen with the other variants as well. Studies are ongoing to determine whether there is any impact of other types of tests, including rapid antigen detection tests. So effectiveness of current treatments. So corticosteroids, I will put this link in the description so you guys can check it out. Some of these names are pretty hard to pronounce. And the IL-6 receptor blockers will still be effective for managing patients with severe COVID-19. Other treatments will be assessed to see if they're still effective given the change of parts of the virus in the Omicron variant. Studies are underway at the present time, who is coordinating with a large number of researchers around the world to better understand Omicron. Studies currently underway or underway shortly include assessments of transmissibility, severity of infection, including symptoms, performance of vaccines and diagnosis tests, and effectiveness of treatments. Who encourages the countries to contribute and share the hospitalized patients' data with the WHO COVID-19 clinical data platform to rapidly describe the clinical characteristics and the patient outcomes. So the article continues with the countries. They have recommendations for like actions for countries. So they said that the WHO recommends they recommend several actions for countries to undertake. For example, including enhancing surveillance and sequences the cases, sharing genome sequences on publicly available databases such as GISAID, reporting initial report or clusters to WHO. And they said countries should continue to implement effective public health measures to reduce COVID-19 circulations overall using analysis. So things like those, and then they're talking about people for action. They said the most effective steps for individual to take is to reduce the COVID-19 is to keep physical distance at least 1 meter from others, wear a well-fitting mask, open windows to improve ventilation, avoid poorly ventilated or crowded places, keep hands clean or cough, sneeze into a bent elbow or tissue, and get vaccinated when it's their turn. So they said that WHO will continue to give update on this variant. So this is much of the information that we have currently on this variant. I'll put the link in the description so you guys can go and check out the articles yourself. As always, thank you for tuning in, and don't forget to subscribe for more informative videos. Till next time, take care of yourselves.